Hello everyone. Hello and welcome to another 30-minute live session. I'm Sharsa Chayat Panahi, a biomedical engineer, and today I'm going to be presenting to you an introduction to shoulder and elbow replacement. So this is my 30-minute live on LinkedIn and YouTube on the topic of shoulder and elbow replacement. I will also touch on total wrist replacement and also implants that are designed for finger joints. So please stay with me for the next 30 minutes. And yes, let's dive right in. So I'm going to make the screen larger so you can see images and all the details better. Perfect. Okay, so an introduction to shoulder replacement. What we have here is the shoulder joint. On the left, you can see the details of the bones. For example, you can see glenoid in the middle of shoulder joint, and one of the main bones in this structure is humerus or the upper arm bone. And on the right, you can see all the soft tissue and ligaments and tendon surrounding the shoulder joint. So yes, just wanted to highlight these are the two names that you will hear again about, glenoid and humerus, because the components of shoulder replacement are named after these areas. So shoulder joint, in terms of motion, is a complex joint similar to how we had the knee joint motion that I explained last month. If you look at the picture right here, you can see that there's rolling and sliding motion that enables flexion and extension of the shoulder joint. So in terms of indications for shoulder arthroplasty or shoulder replacement, firstly, let's highlight the goal here. The goal is pain relief and restoration of movement. Now, about the indications, there is trauma, for example, which is, so right here, you can see typically in 3 or 4 parts, the proximal humerus fractures take place, as you can see in the picture right here. Then we have a vascular necrosis of the humeral head, and that would be something like this, where the tissue basically dies because there's no blood supply or there's an interruption of blood flow to that region. So that's another issue with shoulder joint that can happen. And lastly, we have osteoarthritis and rheumatoid arthritis. And if you look at here, you can see shoulder osteoarthritis stages from 1 to 4, which is very severe osteoarthritis of the shoulder joint. I just wanted to highlight that for shoulder joint disorders like this one, treatment options range from non-surgical approaches like physical therapy, for example, medications and injections, to surgical interventions like arthroscopy is another thing. It's different from arthroplasty or joint replacement. It's arthroscopy, which is a minimally invasive procedure where a small camera, also known as arthroscope, is inserted into the shoulder joint to examine and repair tissues. Or, of course, we have shoulder replacement, depending on the severity and type of condition. Moving on, here you can see total shoulder arthroplasty on the left, and on the right we have reversed shoulder arthroplasty. These are two types of shoulder joint replacement. Basically, the one to the left is conventional. It follows the structure of an actual shoulder joint. And the one to the right is reverse shoulder arthroplasty. So reverse total shoulder replacement may be indicated for conditions that include, for example, completely torn inoperable rotator cuffs and rotator cuff tears in association with arthritis. For example, cuff tear arthropathy. That is one condition where this structure or this type of implant, reverse shoulder arthroplasty, would be used in that case. Basically, in reverse total shoulder replacement, the socket and metal ball are switched around. This allows the patient to use the deltoid muscle instead of the torn rotator cuff to elevate the arm. Yes, and lastly, there is the partial or hemi shoulder replacement as well. So the one you can see right here is real life implant that follows the concept of total shoulder arthroplasty. And if you look at this one, this is reverse shoulder arthroplasty with the ball being on the side of, you can see here on the right. Okay, so moving on, we have here the components of a shoulder joint replacement system, and you can see there are different materials and different designs. For example, this right here is conventional shoulder replacement, so it's not reversed, and the humeral head sits on humeral component, which goes in humerus bone right here, and then we have glenoid component, which is a plastic or polyethylene component that would go right there. So this is one example. We have this example as well. It's called inset shoulder implant, and it can be stemmed, like this one to the left right here, or stemless, which basically has a much shorter area that is implanted inside the bone right here. So this is another design, and you can see similar structures in the X-ray right here. And now comparing component names in the two systems in terms of conventional and reverse shoulder replacement. So if you look at this one right here, we have glenosphere right here in the reversed shoulder replacement system. We have humeral cap, which is a polyethylene component, and humeral stem component right here as well. And to the right, we have conventional system of a shoulder replacement where the humeral head component sits directly on the humeral stem component right here. And then you have glenoid component. And I hope you can see the difference between the two, even in terms of sizes, materials, and all of that. So again, in real life scenario, this is what the implant would look like, because this image seems to be exaggerating this humeral head a little bit. This is more what you would see in real life. And this as well is the reversed system right here. Just a few points to highlight regarding indications, which we already touched on, and also recommendations for patients. So yes, Shoulder replacement indications could be arthritis, stiffness of the joint, loss of motion goes hand in hand with that one, and grinding sensation, which is not comfortable for the patient. And then benefits of total shoulder replacement include pain relief. So that's the same with all joint replacement, hip, knee, ankle, all of them. They're designed to remove the tissue that is causing pain. So pain relief is one of the immediate effects. Comprehensive recovery is something the patient would need to consider before surgery because that is the way forward during recovery period. And restoration of motion, strength, and function. Now, about the time scale and how long things might take. Total shoulder replacement involves replacing the damaged joint with a prosthesis, including the ball and socket implant tailored to the patient's anatomy. The surgery, lasting about 2 hours, requires a short inpatient stay followed by immediate, limited physical therapy. A comprehensive rehabilitation program is also essential for recovery, with most patients regaining basic function within 2 weeks and full use within 8 weeks. But remember, this is not a one-size-fits-all kind of situation. This is just an estimate. So about your journey, it's best to discuss with your own surgeon and surgical team. And this is just to give you an idea, but your recovery journey might look different to this. Here, this is a data from National Joint Registry report for last year. So the data is for 2023 that was published last year. Here we are looking at complications and risk of shoulder arthroplasty, risks and complications such as infection, dislocation, and other things. But here I just wanted to highlight the top 3. We have aseptic loosening, component disassociation, and dislocation. So these are the top 3. And I can get into the details of these, but that would make my presentation much longer. So just so you're aware, loosening and dislocation, because disassociation is also components becoming relative from each other, like dislocating from each other relative to one another. So in a sense, dislocation and loosening would sum up the problems that can happen, the top 3 problems. And then in terms of statistics, so in 2023, there was 8,221 primary replacement of shoulder joint. Primary meaning the patient has a problem with their shoulder joint, and for the first time, the surgeon would put an implant in there. If there's already an implant in the shoulder joint and the surgeon would need to replace it, it is called a revision replacement. But this is not what we are talking about right here. 8,000 primary replacement procedures is what we are interested in right here. Average age of patients. So for male patients, average age was over 68.5, and for females, over 73 years old, and 67% of patients were females. Now, the reason for having the surgery in the first place: acute trauma, 14%, but the biggest chunk is osteoarthritis. That's just joint wear and tear, and cuff tear arthropathy as well. So I just wanted to highlight this. And following your shoulder replacement, things to consider. There are certain do's and don'ts following any joint replacement, shoulder being one of them, that you should adhere to in terms of post-surgical care, including Firstly, do follow your physical therapy program and perform the exercises 2 or 3 times per day or as prescribed. So it's important to pay attention to your physical therapy sessions. Then, yes, highly recommended to ask for assistance, especially in the first few days following surgery. Avoid placing your arm in any extreme position. Do not push yourself up in bed or from a chair with your injured arm or the one that you had surgery on. Do not overexert yourself or push yourself too hard. Do not lift anything heavy for the first 2 weeks or until you have been cleared to do so by your surgeon. Again, this is just to give you an idea. You would need to ask these questions from your surgeon directly following your surgery. Now, if you're enjoying this session, feel free to click on the reaction button if you're on LinkedIn, and click to like this live session if you're watching this from your YouTube. Yes, just let me know if you are enjoying this session right now. Next, we are covering an introduction to elbow replacement. So this is the anatomy of elbow joint. You can see structure, you can see the bones. Right here we have humerus, so distal end of humerus, and we have radius and ulna. And here you can see the soft tissue. I apologize for the background noise as well. Joint capsule and other soft tissue that covers or surrounds the elbow joint. So here you can see a healthy or normal elbow joint, and here is elbow with arthritis, a stiff joint that is uncomfortable to move, and yes, surgery would be performed on the joint, and this is an example of one design of component for elbow joint replacement. There are different designs for elbow joint replacement, but just to highlight again, in this right here we can see humerus, the bone at the top, that there's a component that is inserted right here. We have replacement elbow joint, the whole system going up here and down to this side, and we have radius and ulna. So radius is the little bone and ulna is the larger one containing this large component right here. Similarly, this is also the same construct. And this image right here on the right, just to show you the variety of sizes and materials that can be used for elbow replacement, from very large systems, most likely used in a revision elbow replacement, to very small part metal, part polyethylene components, as you can see on the right. We also have partial and total elbow replacement, as you can see here. So right here you have a total elbow replacement with humeral component right up here. Ulna, this component would be implanted into patient's ulna bone, and this right here is inserted into radius. And this is a partial elbow replacement in terms of just covering this top part and radius or radial component right here. Now, this is something interesting that I wanted to share with you, but just highlighting that this is non-FDA approved hemiarthroplasty of either radiocapitellar, as you can see right here, so between these two areas. Again, sorry about background noise. Or distal humeral. So this is humerus bone and this is distal humeral component, and this is two components between humerus and radial or radius. So right here what we can see, if you look at these images right here, you can see radial head replacement. So these also come in different shapes and sizes, but these are designed to replace only the radial head. So if you remember, this is humerus, ulna, radius, and this would be radial head replacement. Okay, moving on. These are again other designs of elbow replacement systems, from very small components right here to very large ones like this one right here. If you take a closer look at some of these are not all the same system. These have their own, like if you pay attention to this gap right here, it's different from this structure, and these provide different types of stability and function in the joint. And of course, this is one of the older designs that I wanted to highlight. Yes, so what we have here is National Joint Registry data for elbow replacement in 2023. Less than 1,000 primary elbow replacement procedures took place. Average age of male patients 55 years old and female patients just over 65 and a half, and 65% of patients were females. And this is the top 3 reasons for total elbow replacement or radial head replacement, so any type of elbow arthroplasty. 37% of the patients had a total elbow replacement with or without radial head. 49, almost half, had only radial head replacements, and 10% distal humeral hemiarthroplasty, something like that. Now, if you look at this graph right here, it is comparing distal humeral hemiarthroplasty, all of these up here, the orange frame for the orange line, and total elbow replacement, this right here for this purple line. And as you can see, years since primary, meaning when the patient had their surgery, 4 years later, 5 years later, what's the risk of revision? What's the likelihood of that patient getting a revision surgery, meaning the primary implant would be taken out and a new one would be put in? So if we look at, for example, number 5. So 5 years after primary elbow replacement, there's between 4 to 5%, 4.5% chance of revision surgery if the system looks like this, total elbow replacement. But it will be more like over 6% for only distal humeral hemiarthroplasty. It's trying to tell you that this is performing slightly better. Okay, so that's based on the most recent National Joint Registry data. Now, before we move on to our last section, if you don't mind, let me know if you're enjoying this section by leaving a reaction on LinkedIn or just liking the live session on YouTube. If not, put some comments in Tell me why you're not enjoying this. Is it the content, the visuals that I've used, the speed of my presentation? Feel free to either just type one word, just tell me what is it that's not working for you, or provide me with some feedback. I would really appreciate that. Okay, next we have a bonus section, an introduction to hand/wrist joint replacement, as you can see in the image right here. But first, let's look at the bones. So, hand bone, we have ulna up here and radius bone. So if you pay attention at the joint up here, elbow, we have the larger head of ulna up here, but when you get down here, ulna is the smaller bone. So that's something interesting to remember. And likewise, radius has the smaller end up here, proximally and distally. Radius gets the bigger chunk of bone down here. So radius bone and ulna. And then we have carpal bones. These are the bones in your wrist right now. And metacarpal bones are the bones in the palm of your hand. It looks like finger bones, but it is just the palm of your hand. And then you have the finger bones. And each of the finger bones have a base, a chunkier base, and then the body, which is longer and narrower, and then the head as well. So, like any other joint, we also get osteoarthritis in our hands. If you look at these wrinkly areas, this is to show osteoarthritis right here in the hand, in the fingers. And this is what a healthy joint would look like for comparison. Finger joint replacement or arthroplasty looks something like this, can be from metal or polyethylene. There is also something called joint fusion. If you were with me last month, we covered this in ankle replacement because we also had a surgery that is called ankle fusion. So basically when the two bones are fused together, and some joints are best suited for fusion, the ones you can see right here. And some joints in your hand are suitable for joint replacement, the ones you can see right there. Okay, so if you pay attention to this right here, these are the damaged joints. And based on what we said in the last slide, the top joint is fused. So this is joint fusion right there with a pin, and bottom area or joint, we have joint replacement, which is very interesting to see both next to each other. And again, so top right here, and these are the joints best suited for fusion. And down we have the joint replacement, and these are the joints that would take a joint replacement in your hand. Next we have wrist replacement. We have radius down here, and we have some of your carpal bones down in your wrist area. So these two, although they look similar, these two systems, but they're different. If you see, this has a smaller head area compared to this one covering the whole of radius. So the one you can see on the left right here is called re-motion system, and this one on the right is called Motec implant. So these are a few examples. Moving on, we have a few more examples. This is similar to what we saw in the last slide, and this is a completely different design, a ball and socket design for your wrist joint replacement. And I know it's time, but we have just one more slide to cover, and these are the post-operation do's and don'ts. As always, it's recommended that you follow doctor's instructions for a wrist joint or finger replacement. Remember to elevate your hand to reduce swelling. Engage in prescribed exercises only. Seek help if you need to do so. Keep incision area clean, just like any other surgery. Maintain a healthy lifestyle and attend follow-up appointments. These are the important things to remember. And the things you should avoid during recovery is heavy lifting is a big one. So avoid heavy lifting. Do not push through pain, because pain is there to remind you to stop and take breaks. Remember to avoid high impact activities after finger or wrist joint replacement. Do not compare your recovery. This is a big one. As I highlighted several times today, it's not a one size fits all situation. You need to encourage personal progress. Do not ignore warning signs and do not smoke. This will promote healing and reduce complications. I hope you enjoyed today's session. Please send me some feedback, and let me make this smaller. Can I do that? Okay. So thank you for staying with me today. I hope you enjoyed this session. And if you have any questions, if you have any feedback or any suggestions, send them to me. You can either send me a direct message or leave a comment below on YouTube or LinkedIn. I'll be looking forward to some feedback from you. And yeah, I hope you enjoyed this session. Have a lovely rest of your day, and I'll see you soon. Bye for now.